Dr. LouAnn Woodward, Vice Chancellor of Health Affairs and Dean of the School of Medicine at UMMC. Good morning, ma'am. How are you?
Good morning. I'm just fine.
Lots going on. Legislature's happening. We had Jason White on a few moments ago, and apparently everybody's behaving themselves there because they saw what could happen when you don't, and you take a mask off at too close range. Last couple of days, it seems like a little hope there, but I think we've learned to not get too excited. Are the numbers coming out for the rest of the week going to be high again, or do we know?
We don't know. It is a little encouraging that the numbers we've seen these last 4 or 5 days have been better than the weeks preceding. So I think that we need to take that kind of at face value. And while we feel encouraged, and I believe it ties in and supports the governor's mask mandate, I think that, all of that is positive. I don't believe that we should start doing a victory lap right now, however, because we do still need to see the numbers for the rest of the week. We need to see what happens as schools all kick back in and start up. So it's encouraging, and I think confirming that we as citizens in the state of Mississippi can have minor behavior modifications, such as wearing a mask, and it can make a difference. So I've been pleased. Like I said, it's not time to declare victory, but certainly it's a good thing to see a few days worth of numbers that are not looking so bad.
Absolutely. I got to ask you, just away from work and away from being a doctor, just in private life, are you as frustrated with some of the numbers and from some of the mixed messages that go on as far as mask and medicine and everything else? It's got to be frustrating to you too.
Oh, absolutely! It is very frustrating. One of the points that is frustrating about this is how people are seeking information from all sorts of sources that may or may not be reliable. There's so much available nowadays at your fingertips through internet searches and through all the social media platforms. And on one hand, that is great because information is available. But on the other hand, it is difficult to really drill down and determine what's a reliable source and what's not a reliable source. I would just urge people in the situation of a pandemic like we're in right now to really look to healthcare professionals, to look to infectious disease specialists, the individuals who have trained their entire career and really are the experts on these topics, as opposed to so much information that's available out there that really may not be a credible source. It's hard to filter through all of that.
Well, it's also hard to filter from us as lay people which one of these people are which one of these organizations or research centers, certainly if they're from overseas somewhere, or even here, are credible or not. We don't know. We're just confused about this. For instance, there was a report last week that said by an esteemed individual, masks do not help. Now, I thought, as I'm not a doctor, I thought, how could you categorically make a pronouncement such as that? Because the variances are so much. There are different kinds of masks. That's how you wear the mask. That's where you wear the mask. That's when you wear the mask. How can you say that masks don't work? Then, if you'll wait around about 15 minutes, you'll have somebody who say masks absolutely, positively do work. So making some type of announcement on a study that they did, it's just confusing everybody.
It is. And these studies that are being done right now, everybody is trying to take small amounts of data because that's really all you have until we get, some time passes and we really can look at the large data in aggregate. Everybody's taking small amounts of information and trying to then extrapolate that to some blanket statement. And that just really is dangerous right now. I think that I would encourage people to look to individuals like Dr. Dobbs, to look to other healthcare professionals who are taking in a lot of these reports and a lot of the studies and trying to filter through and then share with individuals in the state of Mississippi what they believe to be taking in all of this sometimes disparate information, but analyzing it and then sharing what they believe to be the best recommendations. You know, I've mentioned this before when I've been on with you. Part of our big challenge is this is a relatively new and unknown virus to us. It's not a new virus, honestly. It's been around for years, but the way that it's infecting people right now, the contagiousness of it, the long-term side effects, the long-term impact of the virus, these are all new things. So people are trying to get information out as soon as they can, as soon as they feel like they have a new bit of knowledge, but yet you have to realize it is incomplete.
Well, here's another one, and I've asked everybody about this over and over, and I don't know if there's any definitive data on this. If you are asymptomatic and you don't have a temperature, and as far as you don't know you have it, but maybe the only sign is that you can't, your sense of smell and taste may be diluted a bit. Are you contagious? Nobody's been able to definitively say yes. If you have the antibodies, or if you have COVID and you test for COVID and you don't have a fever, you don't have any symptoms, are you definitely or are not contagious? Can you spread it?
So the way that I would behave in not having all of the definitive information is just assume that you are. I think that is the safest thing. We do know that there have been some patients who have been to an event or been around another individual who's positive, what have you. They've had an exposure, and that the development of symptoms can take up to 4, 5, 7 days. And we believe that in that time period, from the exposure point to the point they develop symptoms, that yes, in fact, they can be an asymptomatic spreader of the virus.
Have you heard anything, the latest studies there, and I know that we've had two things roll out that scared a lot of people. Number one of the reasons we have the cancellations from some of the sports is there were reports, I think, last week before last, and some of the colleges were looking at this on the internal basis of possibility of permanent heart damage or something because of the virus if you overexert. Do you have any information about that at all?
So you're in that one of the aspects of this virus that we don't have a good handle on right now is what are the long-term effects and the long-term impacts. We have seen some patients, and this is true across young adults to older patients, we have seen some patients have very minimal symptoms, and they recover, and it appears that their recovery, by everything you can gauge and measure at this point, is complete, and they are fine, and they are back to normal. We have also seen patients, and part of the real challenge here is, at this point, there's no predictability in which bucket you're going to fall into. Mm-hmm. We've also seen patients who have had infection with the virus, and then they have a prolonged sense or a prolonged set of symptoms following the acute phase. Some of that includes heart failure and heart damage symptoms. Some patients have had neurological symptoms where they just don't quite completely get back to their pre-COVID neurological functioning. There have been issues with blood clotting. So some of these long-term effects of the virus we are just now seeing, now that we have a group of patients who have recovered. Mm-hmm. I'll put that in air quotes.
Can you hold on for a moment? We've got a break coming up, and I want to ask you about the kids too, because there's some new data out there about children, and we'll talk to Dr. LouAnn Woodward about that, Vice Chancellor of Health and Affairs and also Dean of School of Medicine at UMMC. Back with the good Dr. LouAnn Woodward. When we were talking about some of the after effects before the break here, and I got to ask, in that particular group or subgroup, is it a possibility that those that had extenuating circumstances or damages from this maybe went into this with underlying conditions?
That is something that we are looking at, and we would very much like to be able to predict which patients particularly are at highest risk for the longer-term residual effects. But so far, the cases have not lined up cleanly in categories like that.
Yeah.
One of the most perplexing things about this virus has been the lack of ability to predict which patients are going to get really sick, which patients won't, which patients will have a mild course, and which patients in the long run will have some of these long-term sequelae and which ones will completely recover.
I'm a little disappointed in this, and I wonder, and I say this because I have been on the air saying that we are in a remarkable period. And if you had to have the pandemic, I'm glad it waited for us to have this technology to do data mining and to from everything from the vaccine. By the way, speaking of the vaccine, the word is out there. The futures are up about 360 this morning on the word that the Russians, Putin, who apparently gave it to his daughter, have registered the first vaccine that supposedly created the first effective viral vaccine on COVID, and that's moving the futures up about 360 this morning, so we'll find out more a little bit later on with that one.
That's right. There's a lot of energy and positive activity around development of vaccines. I think in this country, when we get early into the next calendar year, hopefully as early as January, but certainly in that time frame, that we will have vaccine availability here to start doing some vaccinations in the population here in the U.S.
I guess this is one of those rhetorical questions to Dr. LouAnn Woodward. I guess it's going to be more important this year than ever to get that flu vaccine?
Yes, you're absolutely right.
Well, that was short and to the point there.
She doesn't mess around.
There's no uncertainty about that.
I thought she was going to. I had a chance to drink a little coffee there, but no, she just got right to the point.
Right to it.
No coffee on that one.
Let's talk about the children, because for some reason, right at the start of school here, even though before we had a lot of data on how they're faring in schools out there, saw this report that a lot of children are coming down with this. Your thoughts, and have you seen any new studies?
So, there are studies that are coming out all the time and trying to look at children. Some are showing that children actually are carrying higher levels or higher titers of this virus in their nasopharynx, so that they are carriers, and while they might not be sick, they can infect others around them. And then there are other studies that don't quite support the findings. Basically it's still early. We still don't know a lot. People are trying to figure things out. We do know that most children have a milder course of the illness if they are infected and become symptomatic. Some of the questions, though not all, but I said most children have a milder course. What we're trying to really tease out right now is what is the impact that these children have on older children, on young adults, and then on older adults, and the impact that they have in spreading the virus when they themselves may not be very sick at all. We do know that happens, but people are trying to quantify just how much of an impact that is.
I would think, and apparently not, that there would be some type of database that you guys filter in, not only UMMC, but every research center, every teaching facility, every doctor's office, every medical clinic, in some way feeding data to a national center where we could put this through a supercomputer to have that data mining to figure these things out, or at least is there something like that? Are we feeding this into some research center somewhere?
I think that the research centers all across the country and here are looking at their own patient populations and trying to determine what trends and what impact they're seeing locally. I do think that as time goes on, there will be sharing of data and trying to look at the national trends.
Yeah.
But just as we're seeing hotspots all around the country in different places, I think there are a lot of activities that are very local and would be different from one state to another. So everybody's trying to get a handle on the situation that's in their own environment and their own community to make the best call, kind of game time calls that they can for what's happening in real time.
I agree with you, but there are some of these things, little quirks, too. We had a story a couple of weeks ago, and there were some researchers saying that apparently people who are eating cabbage seem to have more resistance against this virus. Now, I mean, you laugh at that, but if data mining showed that an unusual percentage of people who loved cabbage and had cabbage in their diet, then that's something that you had to take a look at and study.
So I haven't read the cabbage study. I do like cabbage, that's encouraging. But I haven't read the cabbage study. I think as time goes on, there will be. I'm not sure that there'll be studies related to cabbage, but I do think as time goes on, we'll be able to have greater clarity in what behavioral and sort of risk factors, comorbid conditions, how they really stack up against this virus.
As far as the testing, any update on that you'd like to talk about?
No, I don't have a real update on that. I think everywhere around the country, here in Mississippi, here at the medical center, and everywhere else around the country, testing reagents is a rate-limiting step. Everybody's trying to get in, particularly some of these rapid tests, the materials that we need for that. That's a rate-limiting step. We have our own in-house test here, which allows us to run about 1,200 tests a day, thank goodness. But the challenge that we have with the availability of test reagents is still very real all across Mississippi and all across the country.
I was going to ask you about this health department, and I'm not sure if UMMC was a part of this, but the 500 people in Lexington, did you read that study?
No, that was a health department and CDC study and program that they led. We have the hospital in Holmes County, the hospital up in Lexington. We worked with them on the sides on that, but that was a health department initiative.
They offered free antibody testing, or part of the effort. 235 people selected the option to get tested for antibodies. Of those individuals, 17 of the 235 tested positive for antibodies. I'm not sure if that's could be extrapolated out over a longer or a larger universe of people, but it is interesting that some people walking around did not know that they had it.
That's right. That's right. And, we have done, I think in other places, small biosurveillance studies where you look at a whole population and you determine who has antibodies. And I think that here at the medical center we've seen that, and we've seen that in other places across the country. There are people who have antibodies to the virus who never knew that they, in fact, had it.
Do we also have some, and quickly, don't have a lot of time, do we have some results or data on the people who've been treated with those antibodies?
So we have small numbers of patients that have been treated with the convalescent plasma. So that's plasma donated by individuals who do have antibodies. And those early results are very encouraging.
You are so informative. It is always a pleasure to get you on. Thank you so very much for spending the time with us.
Always glad to do it. Thank you, Paul.
Thank you, man. Appreciate it very much.